Yuanjing from Fujian Provincial Hospital. Alright, let's see the category Cambridge Guide. It is a typical guide for us to discuss communication skills for medicine. It includes 5 steps. Initiate the session, gather information, physical examination, and explain it in the plan. Close the session. Our topic today, how to give information, includes the last 2 steps in the guide, explanation and planning, and closing the session. Always we say communication, and what is communication? It's always about the message. So we will discuss who sent the message, and to whom, and what is the message, and how to send the message, and at last how to react to that. Alright, let's begin. At first, let's see what information we need to send and react in our medical communication in the ward. Okay, please imagine you are a doctor or you are a patient now. There are some questions for you. Alright, please imagine you are a doctor now. And what do you want to tell the patient? Or maybe what the patient wants to know from you, and what effects or aims do you wish to achieve, and how to do that. And if you are a patient, what do you want to know from the doctor? What do you worry about? And how do you want the doctor to give the information? Now please think about the questions 2 or 3 minutes. We will explain or discuss the questions in our class today. Alright, let's come back to our class. If you are a doctor now, what information you plan to give? We list some typical notes on the PPT. Alright. Always the information includes result of the physical examination, result of tests, diagnosis, cause of the problem, necessary further investigations, treatment plan, prognosis, and advice about lifestyle. And we find that if you give adequate explanation to the patient, you can help decrease the patient's anxiety and uncertainty. And the patient will spend less time in hospital and require few pain relieving drugs. And the patients satisfied with their care. And last but not least, patients comply with their treatment. It is very important for doctors. But if you give inadequate information to the patients, what happens? Some research find that if the doctors give patients inadequate information, maybe patients often do not remember the information. And if the patients get inadequate information, maybe they do not follow the advice given. Researchers find that maybe 30% to 50% of patients do not take their drugs. Alright, let's continue. Now we will discuss who sent the information and to whom and any notes for us. Alright, if you are the person giving the information, what will you do? Firstly, we want the patients or others who gather the information can understand the information, of course. So we have to convey the information accurately. And we have to use the ideas in the language that the listener can understand. And last, we need to be prepared to respond, to answer questions, and give some emotional reaction. And what about the person receive the information? We want to help patients or other people who receive the information listen to the doctor and concentrate on what is said. And we want to help patients remember the information more easily. There are some researchers find that lack of information and uncertainty about patients' diagnosis and treatment are more likely to increase anxiety. There is considerable evidence now that most patients want to know what is wrong with them, even if the news is not good. And giving the patients this information has a positive effect on them. And the information is given in a manner sensitive to patients' needs. Symptoms such as pain or nausea. Patients will remember the information more easily if they are able to link it to their existing knowledge. If it has been reinforced during the interview, and if they are asked to review what has been said. There are skills involved in giving information that doctors may not be aware of. Firstly, please do not only tell the patients what is wrong, but what they should do. Secondly, it is often wrongly assumed that patients are not capable of understanding explanations of their medical problems because of lack of knowledge. Thirdly, it is often assumed that patients are made more anxious if the details of their problem and its management are explained to them. There is considerable evidence now that most patients want to know what is wrong with them, even if the news is not good. Giving patients this information has a positive effect on them. Now let's discuss how to give information.
Let's try this video. Giving me a pretty good idea about the nature of the pain. I guess I want to understand a little bit more about what makes it worse. Are you aware of anything like diet, activity, or stress?
You don't think this is in my head, do you?
I guess I need to understand better why you're asking me that.
Well, several physicians have suggested that stress is what's causing my pain. And Dr. Smith, my primary care doc, have sent me even to a psychiatrist. And the psychiatrist thought I'm fine. And I know I'm not crazy. It's not in my head. And I did not have this pain before. And this is very frustrating.
So I guess you're concerned that other doctors are saying that this is stress, and you're wondering by my question whether I think that this is a psychiatric problem?
How would you feel?
Well, you know, as a result of our evaluation today, I know that your GI symptoms are very real. And this is not a psychiatric condition, this is a GI condition. But just like any other condition, I think we need to understand what factors make it worse. And there can be things like physical activity or stress. And one of our jobs is going to be to try to see which kinds of things might make it worse. And then by having that information, we can work out some solutions.
So you don't think it's in my head?
No, I don't think it's a psychiatric problem at all.
Okay.
Well, how are you doing today?
Hi. Same old. No improvement. You know, I was thinking in the waiting room. I've been coming here for 3 months. My pain is still the same. I know you're trying hard. But there must be something that should get this pain better. I've taken 3 Darvocets before I came here. That's why I'm so comfortable now. The pain is really, really bad. Is there something you can do?
Well, I guess maybe we should, I would like to get a better sense of what your expectations were at this point about how you would be doing.
Well, I was just hoping I don't have to take Darvocets all the time, and that my pain will be better.
Yeah.
That's all.
What would be better?
Well, gone will be good.
Yeah.
I want it gone.
Yeah. And you've had this for how long now, this pain?
Years.
Yeah. Well, I'm just wondering that...
I'm tired.
Yeah. I'm just wondering that maybe we didn't really talk about expectations on the first visit, and you're coming to me now expecting that the symptoms would be gone, but I guess I've seen this as a very different kind of management. You know, you've had pain for many, many years, and I think we have to be realistic in terms of what our expectations are.
You mean I have to live with this?
Well, you do have a chronic condition, much like arthritis, and you know, the disorder doesn't go away, but it goes up and down in terms of its intensity and severity, and what we work on are ways to manage and keep the symptoms under better control.
You mean I'll have to live with this? It's starting again now. I have to live with this forever?
Well, it sounds like that after all these years of pain, your expectation was that it would go away completely. And I think that while we hope that would be the case, is not fully realistic. I think we have to look at ways to reduce the symptoms and make you feel more able to control them.
I cannot function with this pain. I have to get better. I cannot work. I cannot take care of my daughter. My marriage is falling apart. You've got to help me. I just cannot live with this.
Well, you know, you've raised many different types of concerns and issues that we may need to understand and address better. And I think with regard to the pain, realistically, it may not go away, but I'm just wondering if we were to get your symptoms down about 25 or 35%, if that would be beneficial to you.
Well, it would. I don't know whether I can work still, but I'll take it.
You know, you've told me about your symptoms, and you brought up on several times about how you felt very helpless and out of control and vulnerable with these symptoms. I'm just wondering if there are other times in your life where you've had similar types of experiences.
Well, is that important?
Well, I was trying to understand the feelings that these symptoms have generated.
Well, my childhood wasn't, always pleasant. My father was an alcoholic. You know, he wasn't very nice when he was drunk. But I don't see how this has anything to do with my pain.
Well, I guess you're bringing that up now. Were there certain feelings that were generated or experiences that brought on those feelings?
Yeah, I actually don't particularly like talking about it. But probably age 5 to age 15 when he left, when my mom left, was pretty rough.
I see.
He was not a good man. I really don't want to talk about it though.
Yeah. Well, I guess I was just looking to understand if there was any relation between the symptoms and the feelings generated now and the feelings generated then. It sounds to me that there may have been some feelings that made you feel out of control and helpless then too, and maybe that's having a role in the symptoms now.
Oh, I was totally out of control.
Yeah.
I was scared. I was hiding when he would come home because I knew what was going to happen.
Yeah.
But he's gone now.
Yeah.
And I have this pain.
Right. Well, you know, what struck me is that in describing the pain, you use the very same words, and there's no question in my mind that those very difficult experiences can be almost indelible in your mind. And
you think?
Well, they're issues that you have to work through, and I'm just wondering if you're having those feelings now with your symptoms, that in some ways it's kind of bringing you back to that feeling of helplessness and lack of control. And that's something we can work on now. We can't change the past, but we can maybe work on these symptoms now in a way that you're not responding as if you were a little girl.
Okay. I think I'm still a little girl.
Well, what we need to do is to have you work with these symptoms in a way that puts you right back in control. And I just have a feeling that in doing that, these symptoms will be much more manageable.
But is that possible? Can you turn the clock back?
Can I turn the clock back? Well, I think that's something we can decide. Obviously, this is something that you find very difficult to talk about. And if you are interested in addressing this further, perhaps we can talk about it, or might have you see one of my colleagues who can work with you on that.
I don't know.
Yeah.
I haven't talked about it to anybody.
So it's really been preying on your mind some?
It's been better. It did for a long time.
Yeah.
This is really hard. Anyway, what are we going to do now?
Well, I think now's the time where we can work together to get you feeling more in control of your symptoms and maybe find better ways to manage your symptoms. I'd also like to be available to you if you want to discuss those past experiences and see if we can make some decisions about what to do about that.
Thank you.
You could see.
All right, we can see guidelines for giving information to patients. There are 3 steps in our interview: preparation, process, and the reinforce steps. When you prepare to give information to a patient, please describe what information you plan to give, and summarize your understanding of the patient's problems, and find out the patient's understanding of the condition. And in the process of our interview, please outline the structure of the rest of the interview. Please use appropriate language. Sometimes you can use joints to supplement the information. And please give the most important piece of information first, and explore the patient's views on the information given. And please remember, negotiate management with the patient. At the end of the conversation, please check the patient's understanding of what has been said. Now, please take 2 or 3 minutes to read the case. In the case, we can do how to do a good conversation with the patient. Please pay attention to the words in red. At first of the conversation, summarize your understanding of the patient's problems. Step 2. Find out the patient's understanding of the condition. You can use such words. Could you tell me what you think is causing your symptoms? Most people have some ideas or worries about what is causing the problem. Do you have any ideas? Step 3. Please outline the structure of the rest of the interview. Then find that Dr. Smith used what I think is wrong with you, what further investigations you need, And lastly, the treatment I'm going to give you to help the patient to understand that. And about the language, we have to track the patient to understand what we said, especially the medical words. Just like Dr. Smith do, you know what that is. And you can use drawings to help you to explain the disease for the patient. And give the most important piece of information first. We can find that Dr. Smith do a good example. And explore the patient's views on the information given. For example, just like Dr. Smith do, what you feel about that. It can help us to track the patient's understanding of what has been said and what did the patient worry about. And negotiate with the patient. And check the patient's understanding of what has been said again. We can find that Dr. Smith said, "Would you like to go over what we have said?" In this case, we can find some tips for us. Please avoid medical jargon and avoid vagueness. Give specific information to the patient. Please use short words in the short sentences and express in the active rather than the passive voice. For example, we think it's better than it is short, and please express in positive rather than negative sentences. There is an interesting table on the PPT. You find that maybe a word different meanings for layperson and doctors. For example, always we say history. Maybe for the layperson just means all the past, but for doctors that means previous disease. And non-verbal information also can help patients to understand. For example, pamphlet, booklets, or using videos in patients' waiting rooms. They are easy to read and attractively presented. In our clinical practice, always we need to give lifestyle advice to the patients. So how to do that?
Doctor, are you ready for your next patient?
Yeah. Who is it?
It's Ms. Jimenez. I screened her for tobacco use, and she smokes half a pack a day.
Really? Mm-hmm. I didn't know that about her.
Yeah.
Nicely done. How have you been? It's been 3 months.
I think I've been doing great.
And your numbers here, your blood pressure, your blood sugar, everything looks fantastic. My medical assistant checked off the box here that said that you are smoking a half a pack a day. Is that right?
Yeah, I do smoke, but it's
6 to 10 cigarettes a day. How long have you been smoking?
maybe 20 years.
Light smokers also can get into trouble from smoking. So have you ever tried to quit smoking?
I was able to quit.
How long would you say?
3 months. I was so stressed out that I just needed something.
You have 3 kids, right? And so, you want to be there for the wedding. You want to be there for their graduation. You don't want to be just a memory. And so quitting smoking has got to be a priority, just if only for them. Do you smoke in the house?
Yes, I do smoke in the house sometimes. I mean, I smoke little, not too much.
Quitting is really something you could do for their health. The good news is that we now have the California Smokers Helpline, which is a free service available in English and 5 other languages that can provide you with help when you're trying to quit. It sounds like the last time you quit, you kind of did it on your own.
No, it will be great, but I don't think I have the money to.
Smokers Helpline can give you a quit plan, can work with you over time. They have counselors that will call you and work with you over time, and they can even recommend medications that I can prescribe for you that will be covered by your health insurance. Most importantly, they will provide you with the counseling for free.
Okay.
And make a quit plan that works for you.
Okay.
Now, the phone number is 1-800-NO-BUTS. But I can also make an electronic referral here right on the computer, and they can call you in English or Spanish, whatever you prefer. What would you prefer?
Spanish. Thank you.
Yeah. Great.
Step 1. Inquire patient's attitudes. An American social psychologist has proposed a health belief model that can be summarized as the 3 S. Susceptibility. How does the person perceive his or her vulnerability to a particular disease? Seriousness. How does the individual perceive the seriousness of consequences of developing or exacerbating a particular disease? The last S is solutions. How does the person weigh the costs and benefits of a particular course of action, such as giving up smoking? Step 2. Giving information. There are some basic rules about giving information. Organize the information into categories and explain what they are, and give instruction and advice early in the interview. Make the advice specific. Use short words in the short sentences. Avoid medical jargon, and repeat the advice during the course of the interview. Stage 3 is negotiating. It is important to negotiate a plan of action with the patient. Please find out if the patient is still firmly committed to stopping smoking. If so, what does the individual feel is an achievable, realistic target? This should be discussed in the plan of action agreed. And please remember to ask the patient to summarize what has been agreed so that you can check the patient's understanding of the plan. Stage 4. Supporting the patient. It is not easy to change one's lifestyle, such as giving up a lifelong habit of smoking or drinking. So the plan of action that has been negotiated should be reviewed and may need to be renegotiated at intervals. Please read the case. It can help us to understand how to give lifestyle advice. Okay, let's review how to give lifestyle advice. Stage 1. Inquire about the patient's attitudes to health. Stage 2. Giving information. Stage 3. Negotiating. Stage 4. Supporting the patient. Okay, now let's discuss how to obtain informed consent. Please pay attention that all patients who are assessed as being competent must give their consent. There are some examples for us. Physical examination, operation, or clinical teaching. We have to obtain informed consent. There are some rules for us. An informed consent have to include some information about the procedure, benefits, and the risks. And we have to track the patient's understanding. Please structure the information. Use short words in the short sentences. Avoid medical jargon. and check the patient's understanding of what you have said. Please ask the patient any questions. Does the patient give consent for the procedure? And please make the patient must be given voluntarily, and the patient must be considered competent to sign the form. There are some informed consent examples for you. Okay, please read the blank answers on the PPT to help us to review the course today. There are two interesting questions for you. You can search something about the questions online and just think about them after the course. Question 1. We find that more and more patients prefer to search the diseases or treatments online before they go to see the doctor. And what do you think about the situation? Question 2. Please find some medical communication issues. That's all for today. See you.